What I like about NITYR is it's a really small tablet. It comes in the size of baby aspirin, and it can be taken with or without food any time of day, and it doesn't need to be refrigerated. My son was really excited to be able to swallow the medication. He shows everyone that comes over how big he is. He's really proud of himself. He feels like a big boy, really independent. He's really excited. You should definitely speak to your doctor.
NITYR nitisinone tablets are a competitive inhibitor of 4-hydroxyphenylpyruvate dioxygenase indicated for the treatment of adult and pediatric patients with hereditary tyrosinemia type 1, HT1, in combination with dietary restriction of tyrosine and phenylalanine. Important safety information. Do not take NITYR if you are allergic to nitisinone or any other ingredients. Tell your healthcare provider about any health problems, and if you are pregnant or planning to become pregnant and/or breastfeeding before starting treatment. Warnings and precautions. Eye symptoms, developmental delay, and skin changes due to elevated plasma tyrosine levels. Inadequate restriction of tyrosine and phenylalanine intake can result in elevations of plasma tyrosine. Plasma tyrosine levels above 500 micromole per liter may lead to ocular signs and symptoms including corneal ulcers, corneal opacities, keratitis, conjunctivitis, eye pain, and photophobia, intellectual disability and developmental delay, or painful hyperkeratotic plaques, thickening of the skin on the soles and palms. Your healthcare provider should not adjust NITYR dosage in order to lower the levels of tyrosine in the blood. Your healthcare provider will obtain a slit lamp examination prior to initiating NITYR treatment, regularly during treatment, and may re-examine you if you develop symptoms or if your tyrosine levels are above 500 micromole per liter. Changes in blood profile. You may develop leukopenia, reduction in the number of white blood cells, which form part of the immune system, and severe thrombocytopenia, abnormally low levels of platelets, which help the blood to clot. Your healthcare provider will monitor platelet and white blood cell counts and will adjust your medication accordingly. Most common adverse reactions. The most common adverse reactions greater than or equal to 1% in patients with HT1 taking nitisinone are elevated tyrosine levels, low platelets, thrombocytopenia or white cells in the blood, leukopenia, and complaints related to the eyes, including conjunctivitis, corneal opacity, inflammation of the cornea, eye pain, blepharitis, cataracts, granulocytopenia, and extreme sensitivity to light, photophobia, nosebleed, epistaxis, itching, pruritus, skin inflammation, exfoliative dermatitis, rash, maculopapular rash, dry skin, and alopecia. Adverse reactions reported in less than 1% of the patients included death, seizure, brain tumor, brain disease, excessive restlessness, bluish skin, abdominal pain, diarrhea, rash on mucous membranes such as the mouth, gastrointestinal hemorrhage, black-colored stools, elevated liver enzymes, liver enlargement, low blood sugar levels, sepsis, and bronchitis. Drug interactions. Nitisinone can interfere with the effect of other medicines. Tell your healthcare provider or pharmacist if you are taking, have recently taken, or might take any other medicines. Use in specific populations. Pregnancy. The safety of this medicine has not been studied in pregnancy. Tell your healthcare provider immediately if you become pregnant or planning to become pregnant. Lactation. The safety of this medicine has not been studied in breastfeeding women. Tell your healthcare provider immediately if you plan to breastfeed. Pediatric use. The safety and effectiveness of nitisinone has been established in pediatric patients for the treatment of HT1, in combination with dietary restriction of tyrosine and phenylalanine. Use of NITYR in pediatric patients is supported by evidence from one open-label, uncontrolled clinical study conducted with another oral formulation of nitisinone in 207 patients with HT1, ages 0 to 22 years, median age 9 months. Geriatric use. Clinical studies of nitisinone did not include any subjects aged 65 and over. No clinical studies of nitisinone have been performed in geriatric patients. Your healthcare provider will adjust the dose based on your requirements. For more detailed information, please refer to the full prescribing information at www.nityr.com/PI. If you get any side effects, talk to your healthcare provider. This includes possible side effects not listed in this video. You may also report side effects directly by calling Cycle Pharmaceuticals Limited at 1-855-831-5413 or the FDA at 1-800-FDA-1088 or www.fda.gov/medwatch.